Welcome to the weekly dose of self-care, presented by your neighborhood pharmacist. Today, we're going to talk about travel essentials in just 5 minutes. I'm going to take you on a journey to let you know what to prepare before you go on a trip, during your trip, as well as after your trip. Some individuals are likely to get motion sickness when they go on a road trip in a car or taking an airplane ride. If you're one of the unfortunate individuals, then you can try either Gravol or Gravol Ginger. So Gravol is medicated with something called diphenhydramine, and you take 50 milligrams 1 hour before departure, then after that it'll be every 6 hours as needed. It is very important to remember that this medication will make you sleepy. So if you're driving, for example, then this is probably not the recommended one for you. All this thing is that if you use this medication, make sure you try to avoid alcohol. Gravol Ginger has a different ingredient. It is not as strong as Gravol, but it does not have the sleepy side effects. If you wish to use it, then you can take 1 tablet at least 30 minutes before departure. Another factor to consider is if the area you're going to has a risk for malaria. So malaria is actually a severe and life-threatening disease that's caused when an infected mosquito feeds on a human. And if you have malaria, your symptoms may be fever, headache, chills, or nausea. An infection sometimes won't happen right away. It could be 10 days after the bite, or it could be a couple years afterwards. To know if the destination that you're going to has a risk of malaria, you can use the website below, but in general, there are over 100 countries that are affected, mostly in Africa, South Asia, and so on. Now, if you use a website, you'll pull up something like this. Will list you the country, as well as if the area is affected with malaria or the peak season. Then the rest of the information is basically just for the doctor's information to know what to prescribe you. As mentioned, you can catch malaria from getting bit by mosquitoes, so it's very important you use the right insect repellents. If you have any question about what to choose, then you can refer to the Summertime Series Part 1 in the channel. Since insect repellents is not 100% guaranteed that you won't get bit, there are some medications that you can take for prevention purposes. For example, something called atovaquone or proguanil. This has to be prescribed by a doctor, and you gotta take it before you enter the malaria zone, then you continue throughout, as well as 7 days afterwards. So it's very important to plan your trip ahead of time so that you have time to take these medications for prevention. There's also the option of taking this as a treatment purposes, but you'll be taking 4 times the dosage, and usually that has bad side effects. So it's generally recommended to try the prevention purposes, even though it might be more of a hassle during the trip. Here is also a list of vaccinations that's recommended before you go on a trip. If you like the video on explaining the following vaccinations, then please comment below. One of the common issues when you travel across the world is that you might get some sleeping issues. Melatonin will be one of the good ones that is used for jet lag because it helps you go to sleep much faster. In terms of how to take it, it's going to be 1 milligram 30 minutes before sleeping and maximum of 4 milligrams per day. Now, if you do have any other concerns about sleeping issues or how it happens, then you can refer to the sleeping video in our channel. It is common for traveler's diarrhea to happen because the food and water quality at the place you're at might be different than what you're used to. One phrase to remember is peel it, cook it, or forget it. So basically that means when you eat fruit, it has to be something that you can peel the skin off. And you gotta cook it so you never eat anything raw, otherwise you just forget about trying it. Other thing to remember is to use bottled water instead of tap water, just because the bottled water will be sanitized. There is also Dukoral that you can use for preventing traveler's diarrhea. But for one thing, the medication is expensive and not many insurance cover it, as well as that it is not that effective at preventing traveler's diarrhea. But that's something you can consider if you're heading to an area where the water or food is not as clean. There is a cheaper alternative that you can buy if the doctor is willing to prescribe it, and that is an antibiotic called azithromycin, which is generally pretty good at treating traveler's diarrhea, and is also one of the cheaper medications as well. But the key thing about treating diarrhea is that you want to replace the water as well as electrolytes that you lose from having so much diarrhea. So one commercial product you can buy is called Hydralyte. So it comes in little tablet forms, so 1 tablet is usually enough to kind of replenish what you lost. If you like what you're hearing, remember to like and subscribe and turn on notification. I'll see you next Saturday at 8 p.m. Bye!